Lyme disease is a common tick-borne infectious disease caused by the Borrelia burgdorferi spirochete bacterium, which belongs to the family of Ixotidae scapularis ticks and is one of the tick-borne infectious diseases that can be transmitted to humans. Initially, it was misdiagnosed as juvenile rheumatoid arthritis. The name, Lyme, does not come from the fruit lime, but rather from the Old Lyme area of Connecticut in the United States where it was first recognized in 1975. According to a survey, Lyme disease is one of the most disliked things by the majority of people, although it is not necessarily the most disliked disease or thing overall. The most liked thing is apparently sleep. Many famous people have publicly revealed that they have been diagnosed with Lyme disease. These include Avril Lavigne, Alec Baldwin, Bella Hadid, Yolanda Hadid, Chris Christopherson, among many others. However, Lyme disease is not limited to celebrities, and many people from all walks of life can be affected by this illness. Where are the ticks that transmit Lyme disease found? Ticks that transmit Lyme disease are found in rodents during their immature stage, and in deer as their host during their mature stage. If they bite and attach to a human, they can expose them to the disease. Squirrels are also a major host, and because of their familiar and cute image, they frequently come into contact with humans, resulting in many cases of infection. Lyme disease is one of the most common tick-borne diseases in the world, especially in areas where infected ticks are prevalent. It is frequently reported in the United States in the Northeast, Midwest, and Northern California. The U.S. Centers for Disease Control and Prevention, CDC, estimates that about 300,000 cases of Lyme disease occur in the U.S. each year. However, Lyme disease is difficult to diagnose and many cases go unreported, so the actual number of cases may be higher. The risk of getting Lyme disease depends on various factors such as the infected tick prevalence in a specific area, how long the tick was attached, and how quickly it was removed. People who spend time outdoors in wooded or grassy areas are at higher risk of getting infected by an infected tick. Lyme disease typically occurs in the summer or early fall, and children and teenagers living in forested areas are the most common targets of infection. Lyme disease usually only occurs if the tick has been attached for at least a day and a half. So, how should Lyme disease be treated? If diagnosed early in the first stage, local infection can be treated with antibiotics, doxycycline, for 10 days to prevent more serious symptoms. If erythema migrans is found in multiple areas, antibiotics are taken for 20 to 30 days. In the second stage, early disseminated infectious symptoms can be relieved by taking doxycycline for 21 days. However, pregnant women are given alternative drugs such as amoxicillin and cefuroxime. If pregnant women have a history of penicillin allergy, erythromycin is given. In addition, facial palsy, arthritis, and heart-related symptoms can be relieved by taking antibiotics for 30 to 60 days. What are the ways to prevent Lyme disease? The best way to prevent Lyme disease is to avoid getting bitten by ticks, which are the main carriers of the disease. To do so, it's important to avoid areas where ticks are prevalent, such as grassy or wooded areas, and to take certain precautions when spending time outdoors, such as wearing long sleeves and pants, tucking pants into socks, and using insect repellent. Light-colored clothing can also make it easier to spot ticks. When hiking, it's important to stay on marked trails and avoid brushing up against plants or tall grass. After spending time outdoors, it's important to check yourself thoroughly for ticks, paying particular attention to areas with hair. Early detection and removal of ticks can help prevent the transmission of Lyme disease. It's also important to note that not all ticks carry Lyme disease, and not all tick bites lead to infection. However, taking these preventative measures can help minimize the risk of contracting the disease. If you find a tick on your body, use tweezers to carefully and slowly remove it and disinfect the area. When removing the tick, use a pointed pair of tweezers to grasp the tick's head or mouthpart that comes into direct contact with the skin and gently pull it out. Do not grab or squeeze the tick's body. Also, do not use Vaseline, alcohol, lit matches, or other irritants to remove it. Be careful not to twist or rotate the tick when removing it, as this can cause the tick to break apart, leaving the head behind in the skin, which can cause inflammation and infection. If you forcibly remove the tick, the head may remain attached to the skin, which can lead to infection with bacteria. Therefore, be careful when removing the tick. If possible, it is best to seek medical attention and have a healthcare professional remove the tick. Even if you have not had direct contact with ticks, ticks can still infect you through contact with clothing that has ticks on it or through contact with animals such as deer or rabbits. When outdoors, it is important to avoid placing your clothing on grassy fields or places where contact with animals is possible. After returning indoors, it is recommended that you immediately wash your body and clothes that you were wearing. There used to be a Lyme disease vaccine available, but it has since been withdrawn from the market. The vaccine was only moderately effective and caused side effects similar to Lyme disease symptoms. There is currently no targeted treatment for prevention. Can Lyme disease become a chronic illness? Lyme disease can become a chronic illness for some individuals. The symptoms of Lyme disease can vary depending on the stage of the disease, and some people may experience long-term or chronic symptoms. The most common symptoms in the early stage of the disease include a skin rash, fever, fatigue, muscle pain, and joint pain. If left untreated, the infection can spread to other parts of the body and cause more serious symptoms such as joint inflammation, neurological problems, and heart palpitations. In some cases, even after antibiotic treatment, a small number of Lyme disease patients may continue to experience symptoms such as fatigue, muscle and joint pain, and cognitive difficulties. This condition is sometimes referred to as chronic Lyme disease. However, there is some controversy in the medical community over the existence and definition of chronic Lyme disease, and some experts argue that these symptoms may be due to underlying conditions other than ongoing infection with Borrelia burgdorferi. Is Lyme disease fatal? The most important thing when one contracts Lyme disease is to receive treatment as soon as possible. Generally, if Lyme disease is recognized and treated promptly, it is not fatal. It is important to seek treatment as soon as possible if one suspects they have been bitten by an infected tick and show symptoms of Lyme disease. Early diagnosis and treatment can help prevent more severe symptoms and complications. However, if Lyme disease is left untreated or treated improperly, it can lead to serious and potentially life-threatening complications. One of the most serious complications of Lyme disease is Lyme carditis, which affects the electrical system of the heart and can cause palpitations, fainting, and even death. Lyme carditis is a rare complication that occurs in less than 1% of all cases of Lyme disease, but it is considered a medical emergency and requires immediate treatment. Another rare but potentially fatal complication of Lyme disease is serious neurological damage. This can occur when the infection spreads to the brain and spinal cord, causing inflammation and damage to the nervous system. Symptoms can include severe headaches, neck stiffness, and paralysis. If you suspect you have been bitten by an infected tick, it is important to recognize the signs and symptoms of Lyme disease and seek treatment. Early diagnosis and antibiotic treatment can effectively treat the infection and prevent serious complications. So far, we have looked at Lyme disease. Finally, let's address the question with a few assumptions. If you find a tick biting you, will you get Lyme disease? If you have found a tick attached to your body, it does not necessarily mean that you will contract Lyme disease. The likelihood of infection depends on where, in which region, and for how long you have been bitten by the tick. Even if you have been bitten, it takes a considerable amount of time for the tick to transmit the bacteria, so if you remove the tick within 24 hours of outdoor activity, the risk of infection is very low. Therefore, it is important to brush off clothes and take a shower after outdoor activities. If you develop a large, bullseye-shaped rash around the bite area, it is important to visit a nearby medical facility for examination and treatment. Can Lyme disease be transmitted through blood donation or transfusion without being bitten by a tick? There have been no reported cases of Lyme disease being transmitted through the blood transfusion process. However, some researchers have suggested the possibility that non-Lyme disease-causing bacteria could survive in the bloodstream. Therefore, patients who have been diagnosed with or treated for Lyme disease are advised not to donate blood. What to do if you are pregnant and have Lyme disease? If Lyme disease is suspected, it is important to visit a medical facility immediately. With appropriate antibiotic treatment for Lyme disease, doxycycline is contraindicated for pregnant women. It is possible to treat the disease without affecting the fetus, so a prompt diagnosis and prescription from a doctor is necessary. If Lyme disease is left untreated, it can potentially cause infection in the placenta, so caution is advised. To date, there is no clear evidence that Lyme disease can be transmitted through breast milk. Thanks for watching.